Now that you're entering the final years of medical school, it's time to start preparing your transition to becoming a real doctor. In Australia, we call this the internship, but you might refer to it as other things like your residency or foundation program, depending on where you are in the world. Now, the requirements for applying for an intern post vary a little bit depending on where you are, but one thing that's most common and one thing that you will need to consider is having referees for your application. So in this section, I'm going to talk about how you go about finding referees, what sort of referees you should consider, and of course, how to list our referees on our resume. References are required for intern applications in most states and territories of Australia, where I'm from, but they're not required in certain circumstances in New South Wales if you're going through the general application system. But if you are applying in New South Wales for the rural preferential system, they are required. So basically, in most situations in Australia, medical students do need some referees. So what exactly is a referee? Basically, a referee is someone who agrees to have their name and contact details listed on your application and resume so that the selection panel can contact them to ask questions about you. These questions might just be to confirm that you are who you say you are, or they might go quite a bit deeper, seeking to validate things that you say about yourself on your application and resume, and to get a better feel for how you operate from another person's perspective. So it's pretty important to choose your referees wisely. More about this soon. Now, the first thing you should be thinking about before you get to selecting referees is to be thinking where you might be applying for with your internship and checking out all the requirements that there are, including what sort of documents you may need to submit and what sort of information you need to provide. In general, you will need to submit the names of at least 2 people who can vouch for the fact that you've been a medical student. It's generally wise also to have a 3rd referee just in case. Now, in most cases, it's okay for your referees to be supervisors that you've worked with, a faculty member, or even a professional member of the medical school staff. It's best to have at least one medical professional as a referee on your resume. In a few cases in certain countries outside of Australia, there may be a requirement for all of your referees to be doctors, but that's usually not the case. So again, you need to check out the actual requirements. What sort of referees are they looking for? Now let's talk about how you can approach potential referees as a medical student. So here's my suggestion for how you should be going about collecting referees. After you've completed a placement or a rotation, you should consider approaching your supervisor as well as other members of the team to ask if they would be happy to act as a referee for you. Explain to your supervisor carefully that you don't need them to do anything else at this. It may even be that they just need to be listed as a name on your application. So write down their contact details, including the correct spelling of their name, their title or position in the hospital or facility that they're at, and their best email and phone number. It's preferable to get a mobile or cell number. Now, if they're happy to give you this, that's great. Tell your referee that you may need to contact them in a few months' time to act as a referee for you. Make sure that they don't get too carried away now and start writing you a letter of reference, unless you truly think that they might be useful. In my experience, in most cases, referees for internship posts are not actually contacted or just contacted quickly to verify you are who you say you are. So that might just be an email or it might just be a form that they ask you to fill in. Now, before you end this rotation, think about the other members of the team. Who did you get on well with? Who did you respect? Could they also be a good potential referee for you? Think about specialty trainee doctors, nurse managers, and allied health staff. Repeat the step you've just gone through with your supervisor to ask these people for a reference. Pretty soon, in a very little amount of time, you'll have a bunch of options for referees for your resume and application. Does brand recognition matter for medical student referees? Now, some people say it's a good idea to collect the names of well-known people as your referee. You might call this going for brand recognition on your resume. In my experience, particularly for the internship applications, it makes very little difference whether you have a well-known person on your resume. What is more important are a few other matters, which I term recency, relevancy, and diversity. I feel these are the 3 key principles that matter for all types of doctor resumes, including medical student resumes. So when selecting your referees, it's a good idea to think about these 3 key points. Let me go over them again. That's recency, relevancy, and diversity. And let's unpack that a bit more. So what do I mean about recency? Well, recency is about having referees with up-to-date knowledge of your performance. This is normally a requirement for any job that the person considering hiring you gets to talk to your most immediate supervisor, or at least someone who's known you in the last 12 months at work. Now, as a medical student, you probably have a number of options there. Try to ensure that your referees have had some contact with you in the last couple of years, and in particular, make sure that one has had a really good view of your performance in the last few months. Relevancy. Well, relevancy is about someone speaking to the role that you're going into. Amongst your referees, you ideally need one or two who have an idea about the job that you're going to perform. Now, clearly for a prospective intern, this means having at least one doctor as a referee. But think about this more deeply. Are you perhaps applying for a rural internship, for example? If so, it really makes sense to have at least one rural doctor as a referee who can talk about your aptitude for rural medicine. Finally, diversity. Diversity is probably the most often overlooked criteria in my opinion. You don't need to have all doctors on your resume, and these doctors don't need to be all male consultants over the age of 50. A good way to show that you can work well in a diverse health team is to have a range of referees on your resume. At least one male and one female is a good start, but think also about registrars as well as nursing staff, allied health and managers. Often these people get a much better look at you than a consultant would do, so they can make a more effective referee anyway. And the other thing to know is that often on the selection panels for internship roles, you do have nurses and allied health and managers, and they do respect the fact that you choose to put non-doctors down as referees. So how do you know if a referee will be a good referee? Look, I'm often asked how to tell whether a certain referee will be a good referee. So really the best way to assess whether someone will act as a good referee for you is the direct approach. Ask them. Ask them what they would say about you if they're approached for a reference from someone that they respect. Most people will be honest with you. If someone feels like that they can't give you a great reference, they will probably tell you so. And in doing so, you'll likely learn something vital about yourself that you can improve on for the future. It's worth noting, however, that you probably don't want someone as a referee who tends to be really over-enthusiastic about your performance, to the point where you don't feel you merit at all their praise. This may come across as lacking in authenticity when they are rung up for a reference. From a recent literature review that I was involved in, there was some small, very limited evidence that choosing a more junior or younger referee may provide you a more positive reference. But honestly, I wouldn't make this the key criteria for choosing your referees, because as I say, the evidence was small in that study in its significance at best. Finally, you're probably wondering how to go about listing your referees on your resume. So let's talk about how to list your referees on your medical student resume. An example of how you might list your referees is as follows. Of note, you want the name, their title, where they work, and a mobile number and email address for contact. You don't need to include all their qualifications and information, but anything that relates to your job application, in this case we're wanting to work as a rural doctor and possibly become a physician, is relevant. If it's unclear from your work history or education history how this person knows you, make sure this is explained as well. So remember, recency, relevancy and diversity.